Welcome back from that break with our package this morning. Today we are talking health, like you heard when myself and Ezekiel, started the show before the package this morning. Now, amidst global health emergency, Nigeria has recorded Mpox infections with concerns about the country's ability to contain the disease, despite the fact that we've recorded no death. Now, with that being said, this morning we want to take a look at Africa's Mpox crisis, disease awareness and situation analysis in Nigeria. As usual, we have our guest in the house is Dr. Olubusayo Modupe, is the Director of Health Insurance Schemes, State Specialist Hospital Ondo, and also Project Coordinator HIV Program, State Specialist Hospital Ondo City, Ondo State. It's so nice to have you on Daybreak Africa once again.
Thank you very much.
Okay, so let us begin from the top, as it were. There's this scare of Mpox. The entire African continent, Nigeria inclusive, woke up to the reality of this situation in the country. We know that we do not have enough awareness. It's no gainsaying about that. But the reason why we decided to create this show this morning is to create that awareness. And we would want to start from the top by you letting us know, before we actually go into the data analysis for Nigeria so far, let our audience know what Mpox is. Of course, Mpox is monkeypox, previously known as monkeypox, but changed to Mpox. So we will want you to take us on a little bit of education on what Mpox is all about.
Thank you very much. Well, Mpox is now a disease of global interest because Mpox was first discovered, I think, 1958. Then in the lab, monkey. So that was why the first name was monkey. I think in the 70s, it was discovered in human being for the first time. I think a 9-year-old child. And that's all it has been there. We call it zoonotic disease. I will explain. That is, those are diseases that are transmitted from animal to human being. That's why it's called zoonotic disease. And the causative organism is a virus in the family of the pox virus. We have some other pox virus. The one causing smallpox, that has been eradicated, so we are not talking about. But there are also chicken pox. It's a pox virus. And so, it is believed, because I say it's a zoonotic disease, it's transmitted primarily first from animal to man. Of course, man can also transmit to others. So if a man and a person is infected, can also infect others. It has been on for some time, and this current outbreak is not this year. It has been around since last year, going on. But now the challenge, why going on, off, on, off? The whole world is now interested, because before now, it appears it's limited to only Africa. But now,
Pakistan, the United States of America, the whole world is a global situation now.
And so that's why, again, you notice that the whole world is now becoming interested in Mpox. That's the current situation, at least globally now. So that's why WHO is issuing statement, African CDC
issuing
issuing statement.
alerts.
Nigerian CDC is issuing statements. That's where we are currently.
I'd like to wonder, considering the current situation with the Mpox outbreak here in Africa, how can we compare this outbreak with other regions? Are we faring better? Are we doing worse? Or are they holding up just fine over there?
Before now, Mpox appears to be only Africa, a limited disease. We have two types, the clade 1 seen in Central Africa and the clade 2 in West Africa. It appears limited, but again, because of global situation, the way people travel now, and so it's so easy, you can pick from any place and get it to another country in hours. And because globally, before now it was not a disease of public health importance.
It comes and goes, it's contained.
Now it's now getting to virtually every part of
the world.
It's now so important because today I'm in Nigeria. In the next 6 hours, I can be in the UK. Or in the next 12 hours, I could be in US. And so if I'm infected from Nigeria, that means I can take it to UK within 6 hours, to US within 12 hours. And that's why it's now very important to everybody.
Now it's important for our viewers to know that there is a situation on ground, because you mentioned two strains, one for West Africa,
yes, clade 1 and clade
2, and the other one.
There is clade 1 and
clade 2, yes. So there's this particular strain that is quite different. I would really want you to throw more light, because we've been told that this new clade, which is clade 1B strain, the strain is new, spreading quite faster and presenting symptoms such as a wider cover of body rash, more children affected rather than adults, and of course higher human-to-human transmission at an accelerated rate. So as we create the awareness, we would just want you to let us understand why this is different.
Now, anytime we talk about any infectious disease, there's always mutation, changes within that virus. And one of the things they always do is to escape what you have been doing for them. And so what is even driving the current outbreak is a particular strain of the clade 1, that's 1B. And why it's now getting more interesting is that the rate of human-to-human transmission is higher. One, although the fatality is still less than 11%. Because there is higher rate of transmission, then of course the possibility of infecting more people in the society is higher now. Yeah, you talk about children. For even the first case in human being was from a 9-year-old. So children are always at risk. Why? Their immunity is not well developed.
Okay.
It's not only children. Those with diseases that will cause low immunity, like HIV, if not properly treated, their immunity is low. Those on some drugs, anti-cancer drugs, their immunity is low. Those on drugs, probably they did transplants. There are some drugs that will make their immunity low. Even diabetics, their immunity is low. They are also at risk. But this current outbreak is driven by the 1B of class 1.
Strain.
You said the disease is zoonotic.
Zoonotic, yeah.
Zoonotic, and is also communicable amongst human.
Yes.
What-
So that the
what-
first source we went from animal to
To human.
human, yeah.
What type of animal exactly? Is it just monkeys, or monkey are more like the major carriers?
No, it's not only
And
monkey.
even among humans, how can this be transmitted?
Yeah, very good. Let's go. Yeah. One, squirrels. We've talked about monkeys. So monkeys, one. There's squirrels. Then some rats.
Some rats.
Yes. So these are the three main.
So is it more like when we eat them, when we cook them for food, or maybe just slight contact, or you happen to touch
Once there is
our
a
food or
contact
something?
with the diseased animal. If any of these animals don't have the disease, then there's no way they can infect man. But we don't know which one has the disease.
Yes.
And so, if it's by touch or by bite, for example, if the animal bites you, or you have contact with the beddings of that diseased animal, the first source really will be commoner in rural areas where they are nearer to animals, because that's where you easily get close to. Probably you don't even know the animal is diseased. Then some people will even see dead animal. It become we call it bushmeat. You don't even know. Are you getting me? So these are ways it can get to.
So what about people, before we begin to ask about symptoms and
No, he's not done actually.
You're not done?
He's not.
Yes, that's
Okay.
from animal to man to human being.
yeah.
Okay.
Main things. But now, once you now get to human being, then that man or that woman, that boy or girl can now again spread it. One of the ways the spreading or the transmission is through droplets.
Can you explain that? Because
I
not
will,
everyone will understand
Yes,
droplets.
you know why I said that? Because if you remember when we were talking about COVID-19, one of the way to is
Through
droplet.
droplets.
You breathe it out. But because it's droplets, it's heavy. It comes down. And so the distance before it comes down, because it's droplet, is like 1 meter. And that was the principle. Remember COVID-19? Distance, physical distance of 2 meters. Because then, even if that person is releasing it through talking, through coughing, through sneezing, if there's a distance, then that droplet, what it's releasing from the nose while talking, will have dropped to the ground.
Or the surface of a table.
Oh, yeah. Then the other way of transmission between man and man is this through the skin lesion. When we talk about it, contact with that skin lesion, then man can also be infected. So that's why close contact is very important in transmission of
Mpox. So the question I wanted to ask, like two, what about people who have pets there are people who have pets. Should they be worried at this time? What precautions should they take? What signs? What do they look out for, especially at this period? Of course, our focus is Nigeria. Should they be worried?
I have dogs too.
Doctor. Okay.
I have dogs too.
Mm.
But currently, the animals that we know about it are the animals are really listed.
That you listed, okay.
The monkey, squirrel, and some rats.
Rats, yeah. But again, if you touch your pets, then it's important you do what we call hand hygiene. Because it's a simple, yes, we even know, even if the dog will not, but it should be part and parcel. Because one of the prevention message is hand hygiene. Wash your hand.
Personal
with soap and
hygiene.
water, or use hand rub. That's the sanitizer. Nobody is talking about it again.
But doctor, we have situations where people who really love their pets, we see it on TV. I'm not a pet person. Because of situations like this, I get really scared. We have situations where animals sleep on the same bed with their owners. They eat from the same plates. They play, and so that is why we are creating this. No, Nigerians. I've seen. No, I've seen the love between animals and their owners in Nigeria. From where I come from, they sleep on the same bed. They jump on each other. They sit on the chair. They watch TV, and sometimes they're eating. They eat and put in the mouth of the animal, of the dog or whatever animal, and put straight into their mouth. So you're saying at this time that everyone has to be cautious, right?
Exactly, yes.
Wash their hands and keep the animals at a distance.
Yes, as much as possible.
Okay, let's talk about symptoms.
Yeah.
So you've explained transmission from animal to human, and of course from human to human. Yeah. Again, it always comes with symptoms. Yeah. So we would really want you to let us understand what to look out for. Yeah. You know,
at the beginning, it appears like the normal febrile illness. There's fever, there's headache, there's general body pain, muscle pain, back aches, cough, sore throats. That appears, and there's what we call lymphadenopathy.
Swollen
lymph nodes. That appears fairly common.
So at what point should we be worried?
But when it appears like that, you don't even know if it's Mpox or not. Because having fever, headache is relatively common. And this occurs probably from 1st to 5th day after one has become infected. Then why? Well, from when those symptoms occur, 1 to 3 days after the fever, you now notice the skin rash, which starts from the face, extend to all parts of the body, including the palm and the sole of the feet. Now it's when we now know this is not the ordinary sore throat I'm thinking of. This is not the ordinary cough, respiratory tract infection I'm thinking of. This is not the ordinary probably malaria fever I was thinking of, because there's fever, there's headache, body ache, all these things are normal. But when the rashes, the skin lesions come in, then it's now more specific.
No, I think to wonder what are what are the most affected countries currently? Many believe it has to be somewhere in Africa. Some believe maybe Congo, maybe.
Congo is Africa.
Yes, somewhere in Africa, maybe Congo.
Yes,
So,
yes.
But is it
because
true?
that
Is Congo
is yes,
true?
yes. It's from that zone. But we also have the West African type of the clad. That's clad 2. But the clad 1 is started from that. But it's
Please,
not.
do you mind explaining this clad 1,
It's
clad
type.
2?
It's type. There's listen. You are just talking about
Variations
type
per se?
Yes. Type 1 is not when you
And
talk
it
about
require
HIV.
different treatments?
Yes, it's the same treatment. When you talk about HIV, we have type 1, type 2. They are just scientific way of differentiating. They are the same virus. But now, by the time they study them, they notice this is how this look. This is how this look. It's just mean types.
So when you talk about, I remember when we were talking about HIV, not HIV, when COVID was around, there were people who had it, but didn't come down with, that's asymptomatic. They didn't come down with any symptoms, but they carried it and they were able to infect other people. Do you have situations like that? Has it been recorded that it is possible for people to actually have the virus and not present and actually transmit to other humans?
No. Because once that skin lesion is out, they are very contagious at that time. Very contagious.
So there hasn't been any case of anyone predisposing to it and not actually having the rashes, but probably presenting with headaches or the normal signs, but going on to now infect other people. Maybe there have been cases through research?
No.
Okay, so we don't need to be worried, because right now, you know the way it is. The moment you mention this now, when anyone has a headache or has fever, I beg you, no name you, whether you get Mpox now, no. You know the way Nigerians are.
We joke about virtually
everything.
I think we should.
You get some truth. Your body they hot. I beg. You know. So okay, we not see the rash. So maybe you get them and we don't know. So it's important for us to like clear. Okay, let's talk about awareness. Nigeria's awareness. What we actually are trying to do a report to find out how aware Nigerians are. In fact, we want to like corner it in Ondo city by trying to find out how aware, because it is scary of the fact that we've asked some people. I've asked, and it's like, what are you talking about? When I say Mpox, what's Mpox? Okay, monkeypox. Oh, and you don't even know anything about it. We want to create that awareness beyond what we've said now. What more can we say to create that awareness for Nigerians?
Well, we have started on a good note. You know, yesterday, I was on a radio program too, talking about Mpox.
Ooh, what a coincidence.
And it's a phone-in program.
Okay.
You know, nobody called in to ask
because they don't know
about Mpox. It is terrible. But we should not allow that to bother us. Yes, the case fatality, even current outbreak, there's no death in Nigeria. But we need to be careful. Because in itself, there are some complications. For example, you know, monkeypox one of the complications is blindness. Yes. The person did not die, but the person is blind. Because it infected the cornea. And so the person is eventually, it's alive, but blind. So again, what is the government saying about it? We have federal government, we have states, we have local governments. Where are the IEC materials? I work in an hospital. I've not even seen anyone currently. Where are the jingles on TVs?
Radio,
Radio,
newspapers, social media.
Social media. Nobody is talking about it. And you know Nigerians, for who we are, because I'm one of us. When people talk, especially when government talk like that, we take it with a pinch of salt. They're lying. There's nothing called Mpox. Probably international community wants to give Nigeria money. That is why. Because it started with, that was what started with COVID-19. There's nothing called COVID-19. But for those who have families
affected by
it, or eventually killed by that, they understand that no, it's real. Currently, there's no death. But if it continues to spread, there's no way. Because some people will have low immunity. Children, some people will have low immunity. It can eventually kill them. That's why we must not be tired.
Now, you talked about blindness as being one of the side effects.
Yeah.
What other side effects or complications can predispose to being infected?
Yeah. Apart from blindness, it can cause pneumonia, bronchopneumonia. That means there can be difficulty in breathing, and it's not properly managed. It's going to be equal to the same thing. Then there's what we call encephalitis. That it infects the brain tissue. And when there is an infection of the brain, there are possibilities. You can come out as you came in, or you may not fully recover. There can be sequelae. Yes, you appear normal, but because of the damage, then you now notice some things that were not there.
Before.
I tend to wonder the status of vaccination efforts in Africa. How far have we gone? Is it effective as at now? From that smile, I don't think it's good news.
Vaccination.
Yes.
I'm aware that vaccines are now being produced, because what they are using now is the smallpox vaccine.
Is it working?
I'm not sure it's in Nigeria.
I know we don't have, because that's the next question I want to ask.
Before you ask me.
Okay. now I think it's time for us to go for tea, because the doctor is getting were you teasing us?
In Nigeria.
We go for that break. When we return, the doctor will be telling us more about Mpox infection and, of course, the situation in Nigeria. Yes, we're going to continue from the vaccination story. Stay with us. Before the short break, we were actually talking about Mpox infection. Of course, there have been cases registered in Nigeria, though we've not had any death yet. And our doctor, Dr. Modupe, was actually letting us understand about vaccination, trying to answer the question that Ezekiel asked before the break. So, doctor, I would really love us to continue from that point. Talking about awareness, the fact that up till now, Nigeria does not produce vaccines, and now we have faced with a situation. We just left COVID-19. Beside COVID-19, we have other issues we're dealing with. Lassa fever is there. Nobody talks about it, but we know the statistics. Not too long ago, we had cholera. Before cholera, we have diphtheria. Diphtheria was in Delta State. I know that because my younger brother's twin daughters actually came down with diphtheria, which they caught from the school. And thank God they survived that. But while the statistics was being given, Delta State was never mentioned. Of course, from the statistics we got from the NCDC, Lagos State, Ogun State, Bayelsa, and another state are the flashpoints for this particular strain that we have. So vaccines, how come we don't have vaccines? Because again, Idris, the NCDC man, actually said that it's on the way. We're expecting it to come, and we don't have. So how is Nigeria, handled this particular situation? I know our viewers will want to know.
When you talk about vaccination, vaccination is really to prevent. And so even if we have vaccines today, it will not be for everybody. It will probably be for those that have close contacts with infected people. It can't be for everybody. And probably for those with low immunity. For what we are as Nigerians, most of the time we depend on donors to even give us vaccine. That's what happens. And so, of course, because it's affecting the whole world now, so the whole world is also looking into it. And so very soon, the vaccines
will get to Nigeria.
Will get to us.
Or is it already in Africa, but not yet in Nigeria?
I am not sure. I can't be certain. I can't say 100%, but I know, I think in places like Congo, yes, I think they must have been using some things, but I can't say 100%. So but I know for Nigeria that we don't have.
So what's the latest research update on the treatment so far?
The treatment, most of the time, yes, they are testing some drugs, thinking of some drugs, but most importantly, the treatment currently is more of symptomatic treatment. That's what we treat the symptoms. There's fever and pain, we give something for that. And because again, we know within 2 to 4 weeks, it's self-limiting because it's viral. The person will become cured. Even the rash will heal and the person is free. And at that time, when the scar is healed, they are no more infective. So that's the current.
I also tend to wonder how sufficient is the global response. I know for a fact during COVID era, we all were affected, every dish was affected, and the response was really sufficient. Can we say same for the Mpox outbreak?
Now, last week, WHO DG talked about it. I said before now, because it's seen as an African disease, it didn't generate too much interest
from the rest of the world.
Yes.
Until it became a global issue.
Now. And that's why WHO also announced that it's now a global threat. And now everybody is interested. As I said, if you have, yes, it's just fever, you are treating, you think you have malaria, and in 6 hours, you can be in UK. And when you get there,
You just spread it.
The rashes escalation comes out.
Now, talking about the WHO, the WHO is seeking 135 million US dollars to defeat Mpox disease, as it states that it can be controlled, it can be stopped. So that's what Gabriel Jesus actually came out to say, that they, sets action in motion to actually begin to ask the entire world, the globe, to donate towards the eradication of Mpox. Now let's talk about.
Let me just.
Yes.
Why is it now?
Because it's global.
Just coming out.
Because it's now global.
Yes.
It's now global. So
that's why it's so important for our governments in Africa to understand this. They need to start to do something
before it happens. Now I remember you were a guest when we were talking about cholera. Was it cholera? Yes. Of course, we're talking about vaccines. And Ezekiel asked that, do we need to always wait for situations like this to happen before we begin to run helter-skelter? Because there are certain outbreaks, like you rightly said, since 2023, we've been battling this. So it's possible that there will be a recurrence since it happens like every other one. So why wait until we have it happen again, or we have a situation at hand before we begin to run helter-skelter looking for vaccines?
That's the problem. Most of the time, we are reactive. When something happens,
but we have a government.
We react to it. We are not proactive before it happens. And what our government needs to do is to be proactive. Don't wait till it happens. Then you are now reacting to it.
But how come this, because the same thing you said when we talked about the cholera outbreak, we also have a health ministry with a health minister. We also have a government. We dealt with the COVID-19, it was the same thing. Cholera came, the same thing. We always go cap in hand looking for vaccines. What about our professors, the higher institutions? What are they doing about this? By now, because Nigerians excel everywhere they go, in science, in medicine, in sports, art, music, name it. All over the world, Nigerians excelling. How come we are unable to actually replicate same in our country? Why? We have Nigerians outside the shores involved in the creation of vaccines. So why are they not back home? What is the government doing to get them back? Is it, I don't know, is there a theory behind this, why it is not working here?
Is the work environment conducive for anyone to work? The work environment is not conducive. Even currently, if a particular amount is even budgeted for research, is that money released for research? First question. If it was released, did the money budgeted for are the professors that are there are different research institutes in Nigeria, do they have access to that money to run researches, to do this, to do that? So there are a lot of challenges. What is important to the government is it researches. Well, it's easier to go and be begging people, we need vaccines.
So we just take anything that is given to us and become guinea pigs at the end of the day.
Still on challenges. What are challenges in containing this outbreak? in Africa? Because it won't be easy. It can't be easy. At some point, COVID came into Nigeria one way or another in spite of the restrictions and all that was done. So how can we as a continent try to contain this disease very well?
The first thing is awareness, and that's what your station started. I've just started, and developing short videos. We need to increase the awareness. This thing is real. This is how it is transmitted. That's the only way we can contain. If somebody is sick and you have noticed the rash, that person need to present in the hospital, because need to be isolated for treatment. Because we know close contact can become infected. Well, the first thing is we must increase this awareness. Mpox can look like chickenpox. Yes. Well, chickenpox will also come with fever, all those things,
and
before
rash.
the rash comes in. But currently, because of the outbreak, don't think it's chickenpox. Go to the hospital. Let's confirm that let's tell you it is not Mpox.
So what are the tests that will be carried out when people get to the hospital to confirm?
It's PCR. It's not just done like that. Samples will be taken, then sent to special lab.
Okay.
Now we spoke about global response to this situation. I think we talk about government response, the Nigerian government response, health organization response so far. Do you believe the response has been minimum or up to par?
I think Nigeria has just started now.
Just started?
We have just started. What have we done before now? What have we done on Mpox before now?
You're a professional, you should tell us.
That's right. No, I'm a networker. I work in the hospital. I'm not government.
Now the WHO says there has to be a strategic response plan. So do you think Nigeria has a strategic response plan by the last time you checked?
Except I check, except they have done something. NCDC will be working now. And most of the time, what do we do?
Yes.
We just adapt something.
Okay. Let us take a hint from the WHO. Yeah. The WHO says comprehensive surveillance and response strategies must be put into place. I don't know how far the NCDC or Nigerian government has gone. Advanced research should be started, and equitable access to medical countermeasures. That's another point I don't understand, that I would want you as a doctor to explain. What are countermeasures when it comes to Mpox right now?
We know how it is transmitted. So countermeasures will be everything we do so that it's not transmitted.
Okay.
From animal to man, and from man to man. We said it earlier, be careful now with animals. One. And hygiene. Very important. Then, if you must eat animal and its product, it must be properly cooked. Countermeasures.
What about eating out, like Mama put yabasira?
Eating out is not the challenge. The person preparing the food, hope the meat
is well cooked.
If everybody has this information, You need to properly cook. Then you saw a dead animal. What killed it? You think it's cheap.
Lock.
What killed it? You don't know if that animal died from a disease. Naturally you think, this lock. You didn't do anything.
Didn't set any trap.
And you just simple things. These are countermeasures.
Okay.
What about contact tracing? What are the rules of contact tracing and controlling this outbreak?
Yes, because we know close contacts can become infected. So again, it's a way of, at least if you know the contact, if this person is infected, all close contacts, yes, we should get them. And that's why one of those people that should be vaccinated are close contacts of infected human being. Yes, close contact, because already they are at risk because they are close contact of somebody with the disease.
Okay. So if you just joined us, it is Daybreak Africa, where we are creating awareness on Mpox. I know that people will be wondering when they actually see Mpox. It was actually changed from monkeypox to, I think it was last year or 2 years ago.
Yes.
Okay. So Mpox is the same thing as monkeypox. We're trying to create awareness to the public to be careful at this time, and to actually know that there is a situation at hand. No alarm yet. So far, I don't think the infection is up to 50 by Nigeria NCDC, but it is a known fact that we have the infection in Nigeria. Again, the fear is because we do not have data, so one cannot actually say, give statistics. Again, it happened last year, 2023, and now it is happening again, but we do not have that known statistics. We just take what we see. The reason why we are creating this awareness to Nigerians. The doctor rightly said that he went on a radio program, a health radio program, and from Ondo State, nobody called in because it is glaring that nobody knows about it. So, Doctor, over to you again. You have an opportunity to talk to not just Ondo residents, but of course Nigerians in general. How they need to be careful. We want to reiterate the Mpox situation in the world, and of course the fact that it is very close home.
Mpox is real. There's no political jamboree or anything about it. We must accept that first. Currently, it has not killed anyone in Nigeria. But the truth is that because the number affected is also low. But if it increases, then the possibility of killing will also increase. And we know the severity of any disease is based on the immunity of that person, the mode of entry, and theory, the virulence of that causative organism. And all this interplay will be so important in knowing how this person presents. But if more people become infected, we don't need a prophet to tell us it will start to kill people. We don't need any prophet to tell us that. And so that's why it's important. Currently, because we know it can be transmitted from animal to man. We need to be careful in handling animal. Now, hand hygiene, washing hands with soap and water. Don't let us forget our old and faithful hand sanitizer. Nobody is talking about it again.
Should you use face mask?
Because it's droplets. Once you maintain distance, there's no problem. Because it's not rotating in the air.
It drops.
It drops. Distance. So that's where we are. Now, if somebody is ill, this is not a time to just stay indoor. It could be more than the ordinary sore throat. It could be more than the ordinary, it's malaria I have. It could even be more than it is chicken pox. It could really be Mpox.
Now, Dr. Bayelsa, Cross Rivers, Ogun, Lagos states are the most affected by the outbreak. What should the Nigerian government begin to do now to stay the spread of Mpox? Because you've talked about our personal hygiene, how we can help ourselves during this period. Again, the government has a lot to do in ensuring that they contain the spread, because that, again, when I started, is a major problem of the fact that there's so much concern of the ability of the Nigerian government to contain the spread of Mpox. So what should government do now, since it's been identified that 4 states, 1, 2, 3, 4 are the flashpoints so far? What should they do to ensure that we do not have a crisis in our hands?
As I said earlier, Nigerian government, they are used to being reactive, and they have started their reaction. So first is, what is the plan? Let's diagnose, let's isolate, let's start to inform people that this is real. How is it transmitted? Let's start to inform people. And with special interest now on people with low immunity, because there are at risk, even including health workers. So currently, if we improve the awareness, everybody will know that this is true. If you tell me it's in, you are not even the one telling me, if it's in Lagos, how many people leave Lagos to other, I don't want to say Ondo State, to other states in the country every day? Through airplane, through night buses, through normal bus. Thousands, you know Lagos now. So if it's in Lagos, then it's technically in all parts of the country. So that's why even places where there are no known identified cases, or let me say, it's not known identified, no known confirmed cases, because there are cases, possibly. This information about Mpox should be heard loud and clear, and how it should be prevented. That should be the message everywhere now, on the media, both the traditional and social media, in the hospitals, everywhere.
In different languages.
Yes, very important.
we want to thank our guest. Time is never a friend. We've been told to round up on the discussion this morning. We've been talking Africa's Mpox crisis, disease awareness and situation analysis in Nigeria. And our guest, Dr. Olubusayo Modupe, is a medical practitioner and our in-house doctor on Daybreak Africa. We appreciate you so much for creating the awareness and pray that we don't come back to talk about it again.
Amen.
Well, that's the show this morning. We want to appreciate our doctor, and of course, you can drop your questions and your comments, and we will answer them. My name is Anire. Binitie. Stay safe.
Have a great day. I remain Ezekiel. Ogar.
Bye.
Yes, there is news on your device, but hearing an analyst's perspective is the icing on the cake that Daybreak Africa provides. Break. Start your day with prompt analysis of the latest news, trends,
Exactly, and then you see these people, they are so agile, they can do a lot of
politics,
We have to go back to that regional system. That is the foundation of this country, for God's sake.
entertainment, fashion, culinary skills,
So first I'm going to be pouring the oil inside the pot and I will...
religious and cultural events, amongst others, on Daybreak Africa.
For a rich mix of analysis on current issues, tune in daily from 7 a.m. to 9 a.m. on channel 480 and 124 on Star Times.